Hello, I'm Cara. I'm the manager of Doris Jones Care Company. We're based in Westcliff. We have roles ranging from just supporting somebody with perhaps a shopping visit, supporting them with some meal preparation, to those clients where actually they need quite a lot of care. I think we're less concerned about qualifications, more concerned about actually what the person's like. Are they reliable? Have they got good common sense? Have they done something similar through, I don't know, guiding or volunteering or something? But actually, just give us a call, just come and speak to us and we can help.
My name's Martin. I'm a support worker for Southend Care. I didn't get into social care until later on. I'd had other jobs, but wasn't really fulfilling enough. Then I got into support work and I found that I actually loved it. To me, it's not like a job. Caring for these guys is just like a bonus. My regret is that I never done it earlier.
I'm Jasmine, I'm a third year student at Anglia Ruskin and I'm based in Essex. A role of a midwife is working with women and families and the help you give with them bringing life into the world. Midwifery I didn't choose it, it sort of chose me. The more I looked into it and after having my little girl, something just clicks. I'm not very academic, so I can't say that I like the academic side of it, but coming into the skills and being really hands-on, having your skills days with your friends and learning to be more hands-on, it prepares you then for placement, and that is what I love about it. The fact that you're in hands-on helping people, it is what the course is about. Most of my deliveries that I've had, I either cry or I walk out and I'm just like, I'm in awe of what I've just done, and I've done that. No one else can say, oh, I helped you. No, I done that. That's me. That's all me.
I'm Amelia and I'm a care assistant for Doris Jones in Southend. I assist individuals to stay living in their homes for as long as possible. Could be a variety of different things, from taking them out on day trips or just going around for a cup of tea to more personal care. I wanted a job that made me feel like I was making a difference in somebody's life. I was originally working as a lifeguard, and my favourite part of the day was when some of our regular old ladies would come in for the aqua aerobic sessions, and they were really easy to talk to. They quite liked talking to somebody a little bit younger. So I thought there's plenty of availability out there for care assistants and found Doris Jones, absolutely fell in love with the company, and here I am today.
I'm Elise and I'm a social worker for Southend Borough Council. I work in the exploitation team, so we work with vulnerable young people who are at risk of exploitation. My favourite part of the job is working with young people, building relationships with them and making a difference to their lives. The advice I would give is that it's a really challenging role to go into, but at the same time it can be so rewarding. You're going to have really difficult days, but when you have a good day and you see a positive outcome for a young person, that keeps you driven to continue doing what you're doing.
My name is Sarah. I'm a trainee nurse associate based in a GP practice in Rochford. You need to be able to interact well with patients and people and their family, so good communication and caring and compassion. What I love about my job is the interaction with patients, and the slightest thing that they say that they might not think is concerning and you pick it up, you're able to help them.
My name's Ellis. I work at Doris Jones as part of the client services team. So my day-to-day job is to support the carers that are working out in the community, dealing with phone calls coming in from GPs, medication queries, new client inquiries. I've always loved sort of working in healthcare. I actually initially started looking after a family member, then started working in a care home, started working for Doris Jones out caring in the community. An office job then came up, so I then decided to come and work in the office. I really enjoy the flexibility of it. I also like the fact that I could be at home, and actually if something were to happen with one of our clients, they could call and say, we've had an emergency around the corner, would you mind going and doing that? And I don't think you'd be able to do that in London because I wouldn't be able to get there. I'll always be in healthcare, I think. I just really enjoy looking after people and making a difference.
Hi, I'm Faye. I'm a senior social worker at Southend Council. So I went to university and did a BA degree in early childhood studies and sociology, as I originally wanted to be a teacher, but during my time during that degree I decided I wanted to be a social worker, so I then continued at university for another 2 years to do the masters. So we may get a referral through, That could be from the police, it could be from the school, a neighbour, and they will put in concerns for a young person or a child living at home. It could be that they are being abused, it could be that they're being neglected, it could be that their parents are misusing substances. So our team will get that referral, we will go out to the home, and then we have to meet with the parents of the young people in the home to try and find out what's going on for them. So there was one young person that I've been working with. I'd worked with him for about a year. When he initially opened to me, he was involved in some antisocial behaviour, he was at risk in the community, he was known to the police, and he was also having a difficult time at home. We supported him for about a year, did a lot of work with him, and he's managed to get himself now in full-time employment. What you need to be a good social worker would be thick skin, resilience, confidence, a good listener, and to have a good sense of humour.
My name is Ike, and I'm a support worker here at Southend Care. I'm here to support the tenants, particularly in the things that they can't do for themselves. You've got to be caring, you need to have empathy, you need to just consider people as people. And once you do that, your job is going to be easier, much easier. It will just feel like you are at home in a family setting where you support one another with no discrimination.
I'm Lauren, I'm a final year student at Anglia Ruskin and I'm based at Southend Hospital. So child nursing is a very varied course. There is a lot of anatomy and physiology throughout the 3 years and you're dealing with patients and parents, which is where the communicational side comes into it. I'd like to think that in 5 years I get that senior role of looking after students, being able to train them, because I really do think I could bring something out to them to help them become better nurses.
My name is Jessica, I'm a project support officer and I work for Rayleigh NHS. I help support the projects to prevent people from going into hospital. I like the fact that I'm able to help out with their well-being and to make them have a better life. So after I left school I applied for an apprenticeship within the NHS, and after my year there I then applied as a project support officer full-time. Working with the NHS has actually helped me to realise that there's no limit on where I want to go.
Hi, I'm Nikki and I'm a shift leader and I work for Southend Care. At home I grew sunflowers with my grandchildren, so there was certain people that I support at work that I thought they would get benefit and get something out of growing the sunflowers. So I brought them all into work, and as you can see, all the sunflowers are thriving. Every day she will go out and water the sunflowers, even if she doesn't feel like going down the road for herself, she'll always water the flower. So it gives her a sense of purpose, and the sunflowers are just thriving. The most important thing you need in this role is to have a really good sense of humour, because every day is different and you don't know what's around the corner.
Hi, I'm Angela. I'm in my final year of my midwifery degree at Anglia Ruskin University and I'm based in Essex. So my course involves a mixture of theoretical lectures, practical skill sessions and clinical placements in hospitals. There's a lot more to midwifery than you think. It's not really just about delivering babies. You have to care for pregnant women during the antenatal period. You look after them during labour and throughout their postnatal period up until discharge. To be a midwife, you have to be observant, because not all the information you need to know will be told to you. A lot of body language, a lot of behaviours do tell a lot. You have to be compassionate. There is no way you can get through a day without having some sort of compassion. You meet lots of people from different backgrounds and different situations, and in the end what brings them to you is that they're pregnant and they need your care.